This is Dr. Berlet, and I'm pleased to share with you our data that we published in our paper in 2019. The journal is Foot and Ankle International, and the title of our paper was The Analysis of the Effect of Tibial Stem Length on Coronal Plane Deformities in the Tibial Component of Total Ankle Arthroplasty. So I want to decode that a little bit and start with the idea that you cannot put an ankle replacement in a crooked ankle. So you need the top bone, the tibia, lined up properly over the bottom bone, which is called the talus. This is in fact not very common when we start surgery because a lot of people will have so-called crooked ankles from old ligament injuries. So the interest of our study was if you start with a crooked ankle and then you straighten it, how good is the top component, which is called the tibial component, at staying where we put it in surgery? And does it matter how tall that implant is? So the background is important, is the Inbone 2 implant has segments that are built kind of like Lego inside the body. So you can build a 2-segment Inbone tibial implant, or you could build a 10-segment Inbone implant. The average is 3 or 4. And in this one, we looked at patients who had 2 segments or 2 and above segments. And what we learned is that there was no difference in these patients' study. So the conclusion is that the Inbone 2 is a very good component at resisting the change in position of the tibial component, regardless of the stems that you put in. The impact on our practice is if somebody has very good bone in their tibia, then we probably can use 2 segments. If their bone quality is not as good and we have to so-called chase the bone, then we may add a larger segment. My current average is still 3 segments for the tibial component. Thank you for your interest in our research.